afternoon, everyone, and thank you for joining an AFTA-hosted webinar. We are going to be talking about foodborne illness and the struggle for food safety today with Timothy Linton. Timothy is a distinguished university professor and a professor of law at the Georgia State University in Atlanta, where he teaches torts, administrative law, and regulatory science. He holds BA and JD degrees from the Yale University and has served as a fellow in the Harvard University program in the ethics and the professors, as well as the Hartman Institute for Advanced Jewish Studies in Jerusalem. I think we are going to have a great presentation today, so I am going to let Timothy take it away.
Thank you very much. It's a pleasure to be here. I want to take about a half an hour and talk a little bit about the food safety system in America. To use it as a case study for some larger issues that we might talk about in terms of regulation more generally. I think that I want to offer a little bit of word of caution before I speak to an audience of people who have spent a career in the field doing food safety and pharmaceutical inspections. Many of the things that we're going to cover today are things that you probably know a lot more about than I do. And my hope is that I may be able to draw some connections between some of these things that we talk about that will be helpful to you in your work. And I look forward to whatever feedback that you might be able to provide me. I want to begin my remarks with a lesson that I learned at the beginning of my research and end my remarks with another lesson that I learned about food safety during my research. The first lesson I learned during my research is that there's no such thing as the stomach flu. I, like many people, had traditionally believed that when one gets an upset stomach, it's often a case of what is popularly known as the stomach flu. And I came to understand from food safety professionals relatively early on that influenza is an upper respiratory infection, and that in fact the stomach flu is really acute gastroenteritis, and that much of what we talk about as the stomach flu is the product of foodborne contamination and illness. So what I'd like to do is think about 4 different issues with regard to the foodborne illness outbreaks in America and food safety in general. The first question I want to ask is, how big is the problem? The second thing I want to do is I want to drill down in a particular sector of the food safety system, and I want to talk about fresh produce and agricultural water standards as a platform for talking about some more theoretical issues. It'll be useful to have some practical insights into a particular area of the food system before we zoom out. The third thing I'd like to do is talk a little bit about the food safety system and what we can learn generally about the nature of regulation from it. And the last thing I'd like to do is talk about a number of popular reform proposals and think about how they might or might not work. So the first question is, how big is the problem? This is something that is often asked by people. And as many of you will appreciate, the answer to the problem really depends on the context and what you compare to when you think about the size of the problem. So I want to look at foodborne illness from a number of different angles to figure out just how significant a public health problem it is. We know from the CDC that there are an estimated 3,000 deaths from foodborne illness every year. And when we compare that to other causes of death annually from other forms of illness and an unintentional injury, foodborne illness seems like a relatively moderate public health concern, one of note, but not necessarily a big-ticket item, if you will. It's tiny compared to the number of deaths related to tobacco smoking or obesity or alcohol use or even poisoning. It's much smaller than poisoning of motor vehicle traffic. So I think from this point of view, we might say that foodborne illness is a significant but relatively moderate public health concern. However, when we move on to another way of measuring the issue of foodborne illness, and we look at annual hospitalization rates from foodborne illness and leading causes of non-fatal injury, foodborne illness begins to look like a more significant issue, and it ranks much closer to things like motor vehicle traffic accidents and fires and burns at about 128,000 estimated cases each year of hospitalization from foodborne illness. Next, when we look at annual episodes of foodborne illness and compare that to other episodes of unintentional injury, foodborne illness becomes a very significant problem. And when I talk about episodes, I'm talking about episodes of acute gastroenteritis, that is serious enough diarrhea, vomiting, and nausea to keep a person out of productive activity or away from work for a day. And the CDC estimates that, as many of you know, there are 48 million such episodes every year in the United States. 1 in 6 Americans is affected on average by foodborne illness serious enough to knock them out of work for a day. And this becomes a very large public health problem, much larger than the comparable sources of unintentional injury, such as falls, motor vehicle traffic accidents, cutting and piercing, and natural disasters. And in fact, foodborne illness, it infects more people than affect falls, motor vehicle motor vehicle traffic accidents, cutting and piercing, or natural disasters all put together. The last way I want to look at this is in terms of annual costs of medical care associated with foodborne illness versus other causes of death, illness, and unintentional injury. And again, we see that foodborne illness comes out looking like a relatively middle-sized or moderate public health problem, about $1.8 billion of medical care costs each year dedicated to foodborne illness, much smaller than tobacco, smoking, or obesity or falls, but comparable to poisoning or fires or burns, and significantly larger than drowning or firearms accidents. The next thing I'd like to do is talk a little bit about a particular sector of the food safety system. I'd like to talk about the fresh produce sector. Of course, as many of you know, when we talk about the food industry, we're really talking about a constellation of different industries, many of which are quite different. So fresh produce, beef and poultry, and fluid milk are completely different industries with different types of expertise, different types of inspection regimes, different regulatory regimes, and different types of markets. So what I'd like to do is, instead of talking about the food industry as a whole, I'd like to drill down in a particular area, and I'd like to look at fresh produce, and in particular, I want to look at leafy greens as an example that we can use as a platform to talk about some more general issues related to regulation. For those of you who are unaware, I want to give a brief thumbnail sketch of the history of agricultural water standards and other standards for food safety in the leafy greens space. So we start in the mid-1990s, and in the mid-1990s, there is a rise in the number of foodborne illness outbreaks that are traced back by state and federal authorities to leafy greens in particular and fresh produce more generally. And by 1997, the FDA becomes concerned enough about this that the FDA brings pressure to bear on the industry to try and come up with some sort of system for addressing these concerns about foodborne illness in leafy greens. And a number of leading trade associations in leafy greens get together, and they put together good agricultural practices guides, or GAPs. These GAPs are modeled on the idea of good manufacturing processes, procedures from practices from food processing. And the trade associations put together technical committees, and on these technical committees are members of industry who are leading experts in the field. There are academics, and there are state and federal regulators who are responsible for food safety and fresh produce, who get together and talk together, and they come up with the best guidance that they can. What they do know at the time is that there are 4 general sources of possible contamination for leafy greens, or leading sources. One of them is water, agricultural water for irrigation or crop dust mitigation or other treatments. The other is field sanitation. A third is animal intrusion. And a fourth one is soil amendments. And these are places from which these technical committees appreciate that contamination comes from. Unfortunately, there's not a lot of science available in 1997 to give any precision to these particular guidances. So the GAPs say things like, for agricultural water, water should be tested periodically, and it should be suitable for its intended purpose, or adequate for its intended purpose. That's essentially the extent of guidance for agricultural water in 1997. Around the same time, the Clinton administration starts a food safety initiative in which they argue that they are going to put forward GAPs guidance from the government. And by 1998, the FDA and the USDA issue guidance for fresh fruit and vegetables that essentially track the industry GAPs, and they comparably provide generalized standards. And for agricultural water, that means water should be adequate for its intended purpose. Unfortunately, after these GAPs, both the industry guidelines and the FDA, USDA guidance are rolled out, there continue to be outbreaks. There are more than a dozen outbreaks in the succeeding years, about 850 reported cases of illness. And by 2004, the FDA's patience starts to wear thin, and they start to issue angry warning letters to industry, saying that industry has a problem and that the leafy greens industry needs to clean up the problem by coming up with better safety standards to prevent contamination in the fields. The FDA launches a produce safety action plan in which they call for commodity-specific guidelines for food safety in fresh produce. And in 2005, the FDA starts to issue angry warning letters again, specifically to the fresh produce industry. The leafy greens industry, along with tomatoes and melons, comes up with a number of commodity-specific food safety guidelines. And the specific guidelines for leafy greens, as opposed to just fresh produce generally, again argue that water should be adequate for its intended purpose. So as these commodity-specific food safety guidelines are about to be rolled out in 2006, disaster strikes the leafy greens industry in the form of the 2006 Dole baby spinach outbreak, which many of you will remember. There was a major outbreak traced back to Dole baby spinach. In the early months of the outbreak, or actually weeks of the outbreak, the FDA couldn't figure out where it was that the E. coli from the leafy greens was coming from, and so they issued successive warnings, ultimately warning people not to eat any or consume any fresh spinach. And as a result of this, the spinach industry and much of the associated industry tanked. Sales basically dried up overnight, and the industry was thrown into turmoil. The industry was quite shocked by all of this, and the leading figures in the industry, again, came together and put together technical committees. And in the succeeding year, they decided that they would come up with new leafy greens standards for food safety, and they would provide gaps that weren't just generalized gaps, water quality that was adequate for its intended purpose, but instead would provide specific metrics. The problem, of course, was that there was no particularly new science available in 2006 that wasn't available in 1997. And so in the absence of academic studies and specific data, the technical committee that came together to put together these new GAPS standards metrics did the second best thing that they could think of. They borrowed a regulatory standard from an associated field. And that standard was the Environmental Protection Agency's recreational water standard. The technical committee for the leafy greens industry put together a standard that essentially said that we are going to borrow the standard for recreational water quality on the theory that if it's safe enough to swim in, it's probably safe enough to spray on leafy greens for irrigation and dust mitigation. And that standard was a test for water sampling, using generic E. coli, which is an indicator of human feces or animal feces. And the standard was that any water sample that was taken that produced over 126 colony-forming units per 100 milliliters of generic E. coli would be considered not adequate for the intended purpose of irrigation or agricultural water use. This, along with a number of other similar metrics in field sanitation, animal intrusion, and soil amendments, were put together in what was called the Leafy Greens Marketing Agreement. The Leafy Greens Marketing Agreement was a private industry agreement that was approved by the state of California as an official marketing agreement, and the standards are private standards, but the administration of the agreement and the certification that goes along with that agreement are administered in accordance with supervision by California state authorities. In 2011, of course, the Food Safety Modernization Act was passed, and in 2015, the FDA rolled out its produce safety rule, which is currently still in the process of being implemented. And the FDA's produce safety rule, by and large, in most respects, tracks the California LGMA's agricultural water standards. There are some changes in the FDA produce safety rule, but essentially they took the same approach, and the basic idea is that this is a standard that is built on the platform of the EPA's recreational water quality standards. So with that general timeline in mind, I want to think a little bit more generally about the food safety system and some of the general principles about regulation that we might be able to learn from them. The first thing I'd like to talk about is the idea of a risk regime. It's popular in the United States to think about regulation as a choice between two alternatives. On the one hand, the alternative is government regulation, and on the other alternative is private markets and private ordering and deregulation. And I think most people who are involved in any form of industry regulation realize that this dichotomy really is a false dichotomy. That in fact, in most areas of regulation, like in leafy greens, there are a mixture of public and private entities that are involved in the process of health and safety regulation. The best example of this is good agricultural practices. GAPs were essentially developed originally by industry technical committees that had on them representatives not only from industry, but also from academia and government. And we also know that government guidance and government regulation ultimately takes advantage of the notice and comment process, which also involves a lot of voices and input, not only from government entities, but from private entities in industry and academia. And that in fact, regulation generally is a matter of a mixture of public and private efforts. And it involves what I'm calling a risk regime, which is essentially an infrastructure of public and private entities that are all engaged together in regulatory governance and that develop governance in an iterative fashion and move forward together in steps. It's the same conversation, really, between public and private actors. It's being conducted in different institutional venues, and it tends to move forward incrementally over time. And it's not just a choice between government regulation or free markets. The second thing I'd like to talk about is the competing narratives that are involved when we talk about regulation. There are a number of different stories that people tell when they think about regulation and which way to move in terms of regulatory reform. And I want to talk about three of these stories. The first one is the most common one that one hears a great deal, especially from consumer advocates, and that's the story of regulatory capture. And this story essentially says that regulated industry tends to be very powerful and influential. And in fact, regulated industry is so influential that it tends to shape the actions of government regulators and dominates the regulatory system. And as a result, there are inadequate safety measures put into place by the regulatory system. Now, of course, in the Leafy Greens story that we just told, there is adequate evidence for the idea that industry is enormously influential in shaping government regulation. We know that government industry developed GAPS guidance originally was essentially the basis for the USDA and FDA joint guidance that came out on leafy greens and fresh produce originally. And we also know that the LGMA, a private marketing agreement, is essentially the basis for the produce safety rule that the FDA is currently developing and implementing, and that in fact industry has played an enormously influential role in the development of public regulation in this area. However, that's not the only story that's available. A second narrative that is very common is the narrative of what I'm going to call the big government narrative. And that's a narrative you hear among regulated industry members quite often. And that's a narrative that goes as follows, that there are health and safety problems out there, challenges, and it's often the case that government regulators are tasked by legislatures with regulating them and don't really know how to solve the problem. And so they come to industry and they lean on industry to solve the problem. And that's essentially what we see in leafy greens, that the FDA came to industry in the early years and said, you have a problem in the fields with contamination. We need to figure out some way for you to fix the problem and come up with responsible measures to deal with it. What happens essentially is big government does industry does the best that it can with the information available, comes up with some sort of guidance. And when there's an outbreak, as inevitably there will be some number of outbreaks, the government in some sense gets quite nervous. Agency officials get hauled in front of congressional representatives. They get a tongue lashing. Why aren't they doing their job? And essentially from industry's point of view, they throw industry under the bus. They say industry is not properly regulated. Industry has fallen down on the job. It's not our fault. We don't have the resources to do the inspections. And industry often feels that when government is in the position of getting nervous, they overreact. And in this case, when we talk about leafy greens, in 2006, when the FDA issued a blanket statement warning all consumers off of fresh spinach, the industry perceived that as an overreaction by the government to cover its own reputation. And the FDA was essentially running for cover. There is some evidence to support this narrative. It's not the only story out there, but we do see in the leafy greens context that the FDA often does point the finger to industry when things go sour. The FDA also has, at some times, in the name of protecting the public, issued what industry perceives as broad warnings that have really come at the detriment of industry. The third competing narrative I want to talk about, that's in addition to the regulatory capture story and the big government story, is the third story of inadequate resources. And this is a story that's often told by agency officials in government. And this story goes as follows. State and federal legislatures are extremely fond of passing health and safety legislation that provides very broad and ambitious mandates for regulatory agencies. So the Food, Drug, and Cosmetic Act is a great example. It has tasked, since 1934, the FDA with responsibility for policing the health and safety of fresh produce on farms throughout the United States. The problem that comes with this is, of course, that in addition to the mandate, there are not generally sufficient funds to support the mandate. And so the FDA may be tasked with widespread routine inspection of United States farms. The problem is there's no money for such a task. The FDA barely has enough money to cover its jurisdiction of processing facilities. It certainly has never traditionally had the money to go out and do routine inspections in fields. This is largely true of state agencies as well. And what makes this so incredibly unfair is that when there's an outbreak, The same congressional representatives who have tasked the agency with huge responsibilities but don't provide the money to actually implement them, then blame agency officials for falling down on the job. There is evidence to support this kind of a narrative when we talk about leafy greens once again. As I mentioned, the FDA has been tasked since 1934 with supervising food safety on America's farms, but it has not been given the resources ever to carry out any form of routine inspection on those farms. And in order to do so, it would need a very large appropriation, much more than the congressional overseers have ever put in the budget. So what I'd like to suggest is we have here three different narratives, and the difference in these perspectives tends to drive a lot of the politics about regulation. Sometimes people will shift their narrative, but for the most part, we see these competing narratives often leading different groups to compete in terms of the ways that they think that regulation should move. The next issue I'd like to talk about is what I'd like to call punctuated equilibrium. This is essentially the pattern that regulation takes as a general matter. We generally, in most regulatory arenas, see a period of what many people complain of as deadlock. There's calls for reform, there's a desire for reform, but there's a deadlock. There's no ability to come up with some new solution. And then all of a sudden, there's some shock to the system, whether it's a natural disaster or in our case, an outbreak, or in this case, a pandemic. And all of a sudden, there are massive changes in policy. There's an overhaul or there's a shift, and then we settle back into a new equilibrium. We see this kind of punctuated equilibrium in the Leafy Greens story. We see a long period of time of frustration over the inability to come up with specific metrics to measure food safety over time. And then we get the 2006 Dole baby spinach outbreak, which tends to shake up the industry, which produces the Leafy Greens marketing agreement and helps to contribute to the creation of the FSMA reforms in Congress. And then again, now we're sort of starting to see a slowing down and settling back into another period of what many people are complaining of as deadlock. So this is a standard pattern of what I'm going to call punctuated equilibrium. The fourth thing that I'd like to mention about this area of regulation is the idea of increasing formalization of risk management. We have seen over time a great increase in the formalization of risk management in the United States. This is true in many areas, including things like nuclear safety or health and safety, and we see this in food safety in particular. In the old days, 25 or 30 years ago, the people in industry who were responsible for food safety were essentially quality assurance managers, the same people who made sure there weren't spots on the lettuce and made sure the tomatoes looked ripe and healthy and red were the people in charge of food safety. Fast forward 25, 30 years, we see a field that's populated by people who have microbiology and epidemiology credentials at the master's and PhD level, people with a huge degree of training and sophistication and tools at their disposal. Food safety consultants who used to be, about 20 years ago, retired Q&A managers have now been replaced by auditing firms with various echelons of middle-level management and expertise. Professional associations like IAFP and the International Food Technologists have grown enormously, and we see an increasing attention to training new professionals in these organizations. And we see heightened specialization and sophistication of analysis in risk management in the food safety space. What used to be sort of calling it like you see it and more or less eyeballing operations has now become much more subject to metrics and checklists and greater specificity. We have seen, therefore, in the food safety space, the same thing we've seen in many other areas of American life, which is greater expertise and professionalism that have developed over time. Just like the areas of medicine over the course of the 20th century became highly professionalized, we've seen food safety come into its own with a high degree of expertise and professionalism. The problem is that we're still dealing with incredibly high levels of uncertainty. The best way to think about this is if you go into a major corporation, a food corporation, or any business that produces food in the United States, and you go to the marketing division and you say, we gave you $1 million last year and we invested, what did we get for it? The marketing division will come back eventually and give you a report, and that report will tell you, we got $1 million and here's the increase in sales as a result, and we'll connect to give you a dollar figure for the return on investment. If you go to the quality control department and you give them $1 million in that same company, and you come back a year later and you say, what did we get for our $1 million investment? They will tell you, well, before the investment, we had X number of defective products, and after we had a reduction in the number of defective products, here's what we got for the return on our investment. The same is true in production. We got $1 million. Here's how much our numbers went up in terms of the number of units produced. If you go to the food safety manager in that same company and you say, we gave you $1 million last year, what did we get for it? You will get some report that goes on about some vague sense of a greater culture of food safety in the organization. There are very few organizations that are able to measure the return on investment from their investment of $1 million in food safety. Now, there are some, maybe in meat and poultry, who might be able to tell you something about microbial levels, although even that is somewhat limited, but none of them will be able to tell you what the effect of their investment of $1 million has been on human health and safety. That data just isn't there. The complexity of this issue, the causal chains, are too long and complicated to come up with that sort of information. And as many of you know, that makes it extremely frustrating to try and evaluate what sort of effect any type of reform is having. So with those general features in mind, which as I said are not specific to the food safety system, they're actually general propositions about health and safety regulation more generally, I want to talk about a number of reform proposals and offer some comments, and then we'll open up for some discussion. You all may have some alternative opinions and perspectives to share on these things. The first thing I want to talk about is the importance of focusing government investment on outbreak investigation. If one of the greatest problems and challenges we face in the food safety system is we are unable to connect episodes of foodborne illness to the root causes of contamination that gave rise to them, we are never going to be able to figure out reliably whether or not the efforts that we make in inspection and reform and testing are having effects on human health and safety and reducing rates of illness. And so it seems to me that the most important thing that we need right now is information, and that information is ways to connect illness outbreaks to root causes of contamination so that we can figure out how to connect those two when we go forward in evaluating the efforts that we make to regulate. We won't know whether foodborne illness is out there and occurring, and we won't know what's causing it until we have more investment in outbreak investigation. The CDC and the FDA and state authorities and local health departments have made enormous strides. But as everybody knows, this is an extremely resource-intense part of the food safety system. And it would seem to me that government is really the only entity that has the infrastructure and the expertise to carry this out. This is not a job for private industry. And it would seem to me that the best investment of government resources at this point would be in greater focus on investment and outbreak investigation in order to have the information platform we need in order to plan reform going forward and evaluate whether it's working to improve human health outcomes. What that generally means is we're going to spend more government money on foodborne illness investigation and outbreak. We're going to have to get that money from somewhere. And I would suggest that in the absence of some massive appropriation from state and federal legislatures, which I think is unlikely to be coming, we're likely to see a shift of resources, if we're going to do this, away from government inspections. So many of you may be skeptical of this. I would suggest the following, that at least when we think about the fresh produce sector, we already rely enormously on private audits for our oversight and monitoring of the food safety system. I'm just going to pull some statistics from 2011. By my calculation, in 2011, the FDA inspected about 19,000 domestic food facilities. And if we add to that 6,000 meat and poultry facilities that the USDA regularly inspects, you get about 25,000 annual inspections. If you add to that a few tens of thousands of state inspections, we get around 30 or 35,000 inspections total by federal and state authorities for food facilities. Now, keep in mind, for the FDA, this includes 0 routine inspections on farms because the FDA only shows up on farms after an outbreak. When we compare this 30 or 40,000 annual number of food safety inspections and to the 9 leading food safety inspection audit organizations, private organizations in the fresh produce space, what we find is in that same year, the 9 leading private food safety auditing organizations in fresh produce conducted over 200,000 food safety audits on American farms. Now, that's only 9 of over 580 firms globally who do this, which generally leads to the conclusion that private food safety auditing is occurring in the United States on a level orders of magnitude greater than anything that the government can or is likely to produce anytime soon. And furthermore, in the fresh produce sector, it's almost entirely dependent on private standards. Now, that's not to say that government regulation doesn't play a role. Most of those private audits include and are based on regulatory compliance. But what I'm suggesting is we already rely an enormous amount on private food safety auditing. Now, this tends to work best when that private food safety auditing is paid for by buyers. As many of you are well aware, there's a conflict of interest that occurs when the entity being audited is paying for the audit. And that's created a low level of reliability for many of these audits. My suggestion would be, among other things, to find ways to structure audits so that the buyers are paying for them. And in the absence of being able to do that, we ought to impose civil liability, really a form of professional malpractice liability on private third-party auditors who fall below standards, such that when there is an outbreak, a lawsuit can be brought against the auditor for substandard performance. That would generally result in audit firms needing to buy liability insurance, and liability insurers doing the same things they do with doctors and lawyers and engineers who they insure, and that is to make sure that they live up to the professional standards that are provided by the industry. And if they don't, they won't be able to get insurance. And if they don't have insurance, they generally won't be able to conduct business in the field. The next thing I want to mention is not so much a reform as just a trend, and that is technological innovations. As many of you know, technological innovation is going to solve or at least move a lot of these problems forward. Whole genome sequencing has done an enormous amount in terms of opening up our knowledge about outbreaks. It has increased the number of outbreaks that are visible, and it's also allowed government officials to warn consumers earlier, and so fewer cases per outbreak have occurred. And barcodes and blockchain have gone a long way to beginning to improve our traceability. Now, keep in mind, barcodes and blockchain are great technologies. The problem is they're only as good as the data entry, and we still have a lot of problems in terms of the business model and the culture of data entry at all levels along the food safety supply chain, in particular in fresh produce. The next issue that I'd like to talk about is the maturation of food safety recall and liability insurance. As I mentioned, because of liability in this space and growing concerns about liability in this space, growers have increasingly purchased liability insurance. And that liability insurance means that the liability carriers who provide that insurance not only take in premiums, they do things in order to lower the risk of foodborne illness outbreaks so they don't have to pay for liability when it occurs. And they do this by setting standards for obtaining insurance. They select the risks that they're going to take by pricing insurance and giving discounts to operations that actually have good agricultural practices and food safety standards and regulatory compliance, contract terms, exclusions for those farms that fail to live up to government standards or industry standards, and loss control. They send out individuals who provide consulting to growers in bettering their food safety practices. The next reform that's a popular one is criminal prosecution of corporate executives. This is a reform that has been trumpeted by a number of different consumer organizations. I would say the following. I think it's probably fair to say that for the handful of really bad actors in this space, the Peter Corporation of America or DeCoster Eggs, just as a matter of justice, it's probably a good idea to send a strong signal that that sort of behavior will land a person in jail. I'm less convinced, and I'm not sure that there's data to support the idea that normal company executives, through either negligence or really no fault of their own, are presiding in a company that has been attributed, to whom it's been attributed a foodborne illness outbreak, should go to prison for that. It's unclear that that will change their behavior, other than it may make people fearful of actually taking corner office jobs in this sector. I think we just don't have the data to know that if we somehow criminalized or attach criminal penalties to what are now civil fines and liability, that would improve the food safety practices of companies that are not engaged in intentional wrongdoing. The next reform I'd like to talk about is probably the most popular reform, and this is a favorite among administrative law professors who really like to rearrange the architecture of administrative agencies, and that is the creation of a single food safety agency. This is a proposal that's been around since the Roosevelt administration. Every administration since the Roosevelt administration has called for a consolidation of food safety in a single agency, including the Obama and Trump administrations. And I want to provide a number of reasons as to why this might be a bad idea. The first reason is the political feasibility of this. The congressional oversight committees that oversee the 15 federal agencies that are currently responsible for some aspect of food safety are very happy to have leverage for their constituents with those agencies, and it's unlikely that they're going to support the consolidation of food safety into a single agency and give up the opportunities for patronage that their current oversight roles give them. Second, this would require a massive and complex statutory overhaul of the variety of various complex authorities of food safety to merge all of this into a single agency. I don't see Congress anytime soon overhauling the tax code, and I don't see them anytime soon overhauling the statutory infrastructure for food safety at the federal level. The third reason why this is probably a bad idea is just because you cobble together agency officials into a single institution and give it a single name does not mean that the veterinary science experts in USDA and the microbiologists in FDA are all of a sudden going to speak the same language or share the same professional or regulatory culture. The real core of an agency is its culture and its professional expertise, not the name on the door. And so it's unclear that simply merging everybody into the USDA or merging everyone into the FDA is going to create a unified sense of mission. Next, this would create new forms of fragmentation. If you were to include veterinary drug residues in food in USDA, you'd be splitting it off from veterinary drug approvals in FDA, and then we'd have veterinary drugs bifurcated the same way we have food bifurcated. We'd just be bifurcating in a new way. The last and I think most important reason for this is that at least 6 European nations have actually done this. They have centralized all of their food safety into a single agency, and according to the Office of Inspector General, the best available evidence suggests that while all 6 of these countries claim that this has been a huge success, there is no data to support that this has had any measurable effect on human health outcomes or foodborne illness. So I think that until we have some evidence for the advantages of a single food safety agency, it's probably not a great idea to invest an enormous amount of money up front for, at best, speculative benefits down the road. The last thing I want to suggest is that we probably should look at places in the food safety system that will maximize feedback and learning. Food safety regulation, like most areas of regulation, is an experimental enterprise. There are a lot of things that we don't know. There are a lot of very smart people in government making their best efforts to take their best shot at what might make an advance in this area. And what we need to do is have more experimental design. We need to spend less money justifying regulations at the front end through regulatory impact analysis, and more money at the back end evaluating whether things worked and being honest about whether we should expand them or start with something new. We need more evidence-based regulation, and I think we need to look at places where we could invest in a more experimental approach to regulation in the food safety system. So the last thing I'd like to do before we open the floor to questions and comments is to just share with you the second, probably for you, very obvious lesson that I learned about food safety. When I was first getting started in this area about 6 or 7 years ago, I asked someone at a food safety conference, someone who'd been in the poultry business for quite some time, a relatively naive question, which is, why is it that the poultry industry cannot produce eggs that are zero risk for salmonella? And she said, there's one very simple reason. There's only one way out of the chicken. And that, in some ways, was very helpful to help me understand the very difficult challenges that people in both industry and in government face when they deal with the enormous level of complexity and uncertainty of a problem that people are exercising great deals of expertise to solve, but that has certain inherent limitations given how big the challenges are. Great, so now maybe we could open up for questions and comments.
Thank you, Timothy. Okay, so if you have a question, we are going to ask you to raise your hand. I'm going to lower everybody's hands right now. If you have a question, please lower your hand or please raise your hand and I will unmute you. If you do not feel comfortable speaking in front of everyone, you can feel free to write your question in the question box and I will read it. We'll give everyone a few minutes to either raise their hands or type in their questions. Okay, while we are waiting for hands to be raised, we do have a question that came into the question box. Could you summarize the 3 main narratives for the current food safety system in the U.S.?
Yes, I'd be happy to. The first of these narratives is the narrative of what I called regulatory capture. That's the story about the overwhelming influence of industry and how it exercises influence over government. For consumer advocates, that often means influence that prevents really vigorous regulation. The second of these narratives is the big government narrative. That's the regulated industry narrative that says that government tends to overreact. Government officials are in the business of covering their own behinds when things go sour and throwing industry under the bus, and that the blame often falls on industry, and a sort of skepticism about trusting government because when things go poorly, big government tends to shift the blame. And the third of these is inadequate resources. The experience of agency officials of being given enormous mandates by political bodies, but not being given the necessary resources to carry them out, and being kind of left hamstrung and then blamed by those same political officials when things don't go so well.
Great. Thank you, Timothy. I'm going to give everyone just a few more minutes to raise your hands if you have a question, or like I said, go ahead and type them in the question box. Okay, we have another one that came into the question box. What inspired your focus today on leafy greens rather than dairy or poultry?
The book that I wrote has chapters on different sectors. So as I mentioned at the beginning, when I started this research, I very naively came into the field thinking, well, I'll just write about the food industry. And I started writing about the Jensen Farms melon outbreak. And I quickly realized that the food industry doesn't really exist any more than the manufacturing industry exists. If you wanted to study, manufacturing, you couldn't just study computer chips and assume that you knew everything there was to know about automobile design or firearms sales. So I realized that I needed to drill down in different places. So I have chapters on meat and poultry and the role of foodborne illness and outbreaks in the development of things like HACCP. I have chapters on fluid milk and the use of different techniques and private initiative to clean up the fluid milk supply in New York State and then the rest of the country in the late 19th century. I have a chapter on leafy greens. Much of the material that I covered today deals with that. So I drilled down in leafy greens because you have to drill down somewhere. I think many of these lessons, the sort of different lessons about punctuated equilibrium and about uncertainty and increasing formalization of risk management and competing narratives and risk regimes, those are generalizations that apply not only to leafy greens, but I think they're equally true of meat and poultry and egg production. I think they're also true of fluid milk and the dairy industry. And I think that they're also true, by the way, of energy and environment and labor regulation. So I chose leafy greens because it makes a relatively colorful case study. It's something that a lot of people in general audiences know about because of the recent romaine outbreaks, and it's an ongoing problem. But as I don't want to minimize the importance of meat and poultry. That's, as I mentioned, a very central focus area of the book, and there are at least 2 chapters dedicated to that. I would also add one more thing, which is we tend to have better data in meat and poultry. USDA has a lot more money through its various divisions to do policy evaluation. And as a result, I think USDA has more data than almost anybody on the effects of HACCP and salmonella testing on human health outcomes. With that in mind, it's relatively thin data, and even the USDA thinks it's somewhat speculative, and it's sparse. So even USDA doesn't have the dollars it needs to really do the job that it would like to in terms of policy evaluation to figure out what's working and what's not.
Great, thank you. We are also getting a few requests for the name of your book.
It's called Outbreak, Foodborne Illness, and Foodborne Illness and the Struggle for Food Safety. It's Chicago University Press. If you go to the website, you can get a 30% discount. There's a discount code on the flyer, I think, that was put out by AFDO, and maybe AFDO could send it out afterwards. So you can get the book for around $20. And the book, as I mentioned, goes through these different sectors. I think for many of you, you'll find things that you already know, but I would hope that you may find details of other sectors that you may not have been aware, and also that some of the issues and themes may be knit together in new ways that would help advance some of the work that you do. I don't want to pretend to know the particular areas of food safety inspection better than much of my audience. I'm just hoping to bring to it the perspective of administrative law and regulatory theory to try and connect some of the dots. And in some ways also state out loud some things that a lot of people on the inside know, but that aren't talked about enough in the regulatory system. A lot of people have simple solutions to complex problems, and my job in some ways is to show why it is that there aren't simple solutions to complex problems, why despite the fact that there's so much talent in industry and in government, that some of these problems are really difficult, and that we need to be more sophisticated as a culture about what we expect from the regulatory system and our regulatory officials, and a little less quick to judge.
Great, thank you, Timothy. And yes, I can include a link when I send out the email for the recording. I can include the link in that email for your book. There are a few more questions. So this one is in a reference to the one way out of a chicken. How does SE, Salmonella enteritis vaccination play into that?
So my understanding is that in a number of European countries, they have used vaccination to cull flocks, and that they have successfully culled flocks to eliminate endemic salmonella in the poultry supply. I believe in some Scandinavian countries they've done that, and they've made great strides towards that in England, so that most of the egg supply and much of the poultry supply is salmonella-free reliably. My understanding is that industry here in America suggests that because of the size of the industry and the scale of the market, that scaling those experiments in culling flocks and vaccination up to meet the food supply in the United States would be too big a lift for the industry. Whether or not that's true, I don't have the expertise to know. I would say the following, which is that it probably would do us a lot of good to pilot a number of different programs around vaccination and flock culling, to have some controlled experimentation in the regulatory space, and then to do evaluation in 3 to 5 years. The kind of partnership that often is entailed in rolling out new regulations between industry experts, academia, and government would work very well in small-scale pilot projects. I think industry would be willing, or certain aspects of the industry would be willing to go in. And then what we would need is really reliable accountability for whether or not it was worth the return on investment. I think one of the things that happens to industry is the agencies tend to roll out regulations like the produce safety rule, in no small measure because they are mandated to do so by Congress. And if they drag their heels or they slow down because they don't have the information, public consumer advocacy groups bring litigation, and they are mandated by court order to put the regulation. But nevertheless, they put out a regulation. It costs money to industry. Nobody can assure industry that the science is really there to support the regulation. And furthermore, there's a lot of confidence that nobody's going to be there in 5 years measuring the outcomes because there won't be money for that. And industry's going to be stuck with the regulation and the costs of it without really knowing whether it works. We would do a much better job if we did this on an experimental basis, and vaccination and flock culling would be a great place to try this out. I do know that the USDA has been engaged in more of this type of pilot programming in terms of inspection regimes than almost any other agency, certainly in the federal government, in the food safety space. And the USDA also, as I mentioned, has often done very high-quality evaluations. The Economic Research Service is just spectacular in the USDA, and they've done a lot of really good policy analysis. So I think vaccination is a terrific idea. whether or not it could be scaled up in the United States is something that we need to explore more, and there needs to be money for an experimental approach, not just mandates from Congress and then, the best that can be done under court order.
Great. All right. Would the recent push for legalizing marijuana and CBD be an example of regulatory capture narrative? Why or why not?
Well, my argument about narratives around regulation is that there tends to be evidence for all three of them at the same time. That is, I'm a believer that it's not true that the people who argue for more regulation are right and the people who argue for less regulation are just wrong or pernicious or don't care about safety or only want to make a buck. And I also don't believe that the people who are nervous about regulation, who are skeptical about government mandates, are just in it to make a buck. There's evidence to support their view that government tends to overreact for a variety of reasons. And I'm also of the opinion that there's strong evidence to support the idea that agencies are chronically operating with inadequate resources, and that it's not that agencies officials are lazy or that government officials or inspectors are inefficient. It's that they don't have enough resources. So I would say there's definitely evidence in the cannabis regulations, example to suggest that industry is exercising increasing influence over the decision making by regulators. But I would also suggest that many people in the industry are worried about overreach in terms of regulating this market as it begins to emerge, and that government officials may be prone to overreach. And I also think that government officials increasingly are being tasked with growing mandates around cannabis products that they are not necessarily being given the resources to carry out. So I would say, yes, it's definitely an example, but it happens to be an example of all three narratives at the same time.
Great, thank you for that. Has traceability improved over the years due to new technologies, or has it gotten worse because there are more links in the food chain?
As to the first, I think it's definitely gotten better in the sense that there's more knowledge about how to do traceability well. There have been traceability studies. The book goes into extensive depth about the history of traceability studies and early experiments in Canada, and then in fresh produce in California, and then, of course, with FSMA and IFT studies. And what we know is that the use of things like barcoding and computer and cloud technologies and now blockchain offer opportunities to reduce the effort that it takes to put the data in for fresh produce tracing, and increases the potential for people to, on a phone app in the supermarket, be able to come in and scan a barcode and find everything about the refrigeration history of that product going back to the fields where it was picked. The problem is that while these technologies, I think, have advanced both our knowledge and our capacity, it also tends to be the case that when these things are studied, there's a very low level of compliance at the production level. And the reason for that is it still takes a certain amount of time, training, and culture to get people used to the idea that in addition to all the things they need to do to run a profitable fresh produce business or supplier of any sort or processor or wholesaler or trucker on a relatively thin margin, they also need to do an enormous amount of data entry. And so that complicates things. So yes, there have been great advances, but those advances depend on the underlying capacity and willingness and culture to do the data entry, and we haven't seen huge advances in that culture.
Great. The next question is, tools such as whole genome sequencing and epidemiological studies have led to outbreaks being detected sooner and with less individuals affected. How do you think an even greater increase in this type of research will affect reform in the future? Has it already had an effect?
It's already had an enormous effect. I mean, that's somewhat speculative. I can say the following, that the CDC has some initial evidence. It's not robust, but there's some evidence that because they're catching outbreaks earlier and because they're catching more outbreaks, that the warnings that result from that knowledge are probably leading fewer people to consume, and they have some indication that outbreaks that they would have expected to be larger are smaller. For my money, one of the best investments we can make is to continue to invest in the infrastructure at the state level necessary to increase our capacity to do whole genome sequencing, not only on foodstuffs that are brought in by people who've been struck by foodborne illness, but also environmental testing in fields and production facilities. The more information we have from those sorts of testing operations and inspection, and the greater our capacity to genome sequence them, makes it just much easier to see outbreaks when they occur. So the CDC is seeing far more outbreaks than they did before, not necessarily because there are more outbreaks, but because they appear. And the CDC officials, Rob Tokes at the CDC, likens this to the Hubble telescope. When you look at the sky at night with your plain eyes, you see a certain number of stars. When you look with a high-powered telescope, you start to see a lot more stars, and you start to see things you didn't see before. When you look through the Hubble telescope, you see entire galaxies that we never knew existed before. The same is true with whole genome sequencing. We're starting to connect foodborne illness as long as it's being reported in ways that we never could before, and we're seeing outbreaks that we never knew were there before. That kind of visibility of outbreaks and then the ability to trace them back using whole genome sequencing to match pathogens in the field or in production facilities with pathogens in food that people ate or that got them sick is an enormous advance. The problem is we just don't have as much data as we need. So the bigger the data capacity in that, the greater our knowledge base will be, and the more easy it will be to conduct studies or to run trials in regulatory pilots to say we're going to try something and then we're going to see what the effect is on human health outcomes. We're never going to have perfect information, but we could have much better information. But it has to be built on good public health reporting and inspection and whole genome sequencing to match the places from which contamination comes with the foods where it shows up.
Okay, that looks like all of the questions that we have today. Thank you so much, Timothy, for taking the time out of your day to present this foodborne illness presentation to us.
Thank you. It's been a real pleasure. I'm grateful and honored to be able to speak to people who are out in the field, who've been in this business for a long time, who are protecting all of us from foodborne illness.
And if anyone has any additional questions, you can send them to the AFTO inbox, and we can forward them to Timothy and see if we can get an answer for you. Thank you, everyone, and have a great day.